Okay, so how does psychiatry help people?
All right. So similar to psychologists, counselors, therapists, they're going to listen, they're going to talk with the patient, but then they're also, again, able to do testing and prescribe medications. And
Okay.
so they're helping patients face, the mental, emotional, behavioral disorders, and they're helping them to develop a plan, and they're helping to see them be able to walk out in life, in a more healthy manner. And developing that plan usually involves, again, you're talking, you're listening, you're finding out family history information.
Mm-hmm.
What is the issue that's going on with the individual? And then you may do, further testing, and then getting into, again, prescribing medications that are needed to help them face these challenges that they have.
So, okay. So take an example like multiple personality disorder.
Mm-hmm.
How would you know by talking to somebody? Like, because you can't see that on a brain scan, right?
Right.
Okay, so how would you know by talking to somebody that they had that? Like, how would you be? Because I don't think I've ever met anybody. I guess everyone's medicated and their second personality disappears, which doesn't make sense. But,
Right.
but how would you know if that's actually happening just by talking to somebody?
Yeah.
Instead of them just having different interests or whatever.
Right. So I guess you talk about multiple personality disorders. I think you would be talking about individuals that you're having to counsel over a length of time to find that out. So I don't think that comes out in 1, 2, 3 sessions, and it may.
Okay.
I mean, it may, but I would think you're hearing, and I also wonder if family members don't get involved at that point. And because it's not just that they're counseling that individual, so they may bring in family members, and family members may be able to say, hey, these are the things that we have seen. These are the things that we have noticed.
Or the family members are the ones that come to somebody and say, hey, this person has...
Correct. Because
this person is 3 people.
Right. Well, because I think a lot of times we think of our, counseling as you're sitting one-on-one with somebody, and that is often the case. But also, psychiatrists, psychologists, they're going to be doing therapy with couples, with families, in groups. And so I think in those family settings, I think is probably where some of this information comes out and comes from.
Okay.